what is the Medicare annual enrollment period? The Medicare annual enrollment period is a window each year from October 15th until December 7th, when anybody who is on Medicare can make a change in plans, which will go into effect January 1st. And so what does this mean? Um, this means if you are on original Medicare, you can sign up for a prescription drug plan or change your prescription drug plan. You can, if you're on a Medicare Advantage plan, you can change those plans. You can kind of go back and forth between original Medicare and Medicare Advantage. And it's a one time a year that everybody has the opportunity to make changes to their Medicare plans. And it's a big deal because, you know, barring special circumstances, once you make your decision between now and December 7th, that's going to be your plan starting January 1st, 2025 until the following January. And so it's important to make decisions now that will impact your, your care for the following year. One interesting thing about this period is if you sign up for a plan during this period, you can change your mind as many times as you want. So if you've already signed up for a plan and you've changed your mind, you can sign up for another plan, and the last plan you sign up for is the one that wins. So even if you've made some decisions, you could still change your mind, but it's really important to know that you have to make, you your change before the last day being December 7th. So that's the Medicare annual enrollment period.
Yeah. How about Medicare supplement plans? Are they subject to the same Medicare annual enrollment period?
So the Medicare annual enrollment period, it applies to Medicare Advantage plans and Part D plans. It does not apply to Medicare supplement plans per se, because Medicare supplement plans are not as regulated by the government. They're private plans. However, people on Medicare supplement plans should be thinking about the annual enrollment period for two reasons. Number one is that most people with the Medicare supplement plan also have a standalone prescription drug plan that is subject to the change. And a lot of times, if you're on a supplement plan, you'll have a annual rate increase, and it'll be either on the anniversary of when you signed up for the plan, which is possibly your birthday, or it will be a January 1st. And so a lot of people this time of year will be getting the rate notices for the January 1st change for their supplement plan. That's a very important piece of information. They'll be getting the rate change notice for their prescription drug plan. And so you can think about those two things holistically in terms of what your costs are going to be if you stick with that. And even though you can make changes to supplement plans anytime, this is the only time you can make a change to a Part D plan. And so it is a good time, even if you are, if you're on a supplement plan, you don't, you're not stuck with these deadlines, but it's very much intertwined with the Part D deadlines and sort of thinking holistically about what plan path that you should be on.
Hmm. This might be a good time to ask a related question from one of our members in the forum, and I think there's a similar question in the chat. So the member was asking, she's currently signed out with traditional Medicare, a Medigap policy, and a prescription drug plan, and she would like some information on the differences of traditional Medicare versus Medicare Advantage plans. And perhaps we can also start talking about the difference with Part C and Part D.
Yeah, absolutely. So it's good to have our fundamental terminology down when it comes to these plans. And so let's walk through that. Uh, the first thing to know is that the there are there are a bunch of different parts to Medicare, but let me try to explain it in really simple terms. Um, Medicare Part A, it came out first. It provides you coverage for when you're in the hospital. And most people, 99% of people, qualify for free Part A. They don't have to pay premiums for Part A. They get Part A for their hospital coverage because they have worked for, they have fulfilled their 10-year work requirement. Now, when you have Part A coverage, Part A covers you when you're in the hospital, but it doesn't cover everything. When you're admitted to the hospital under Medicare Part A, you still have to pay a $1,600 deductible. Okay, so Medicare Part A covers you in your hospital, but it doesn't cover everything. What was added next was Medicare Part B. Medicare Part B is your medical coverage when you are outside the hospital. Think you go to see the doctor, labs, x-rays, all your services when you're not admitted to the hospital as a patient in the hospital, all those services, excluding prescription drugs, that's Part B. And Part B, you get, um, you sign up for after you turn 65, and we'll talk about kind of what you can delay Part B if you're under an employer plan for some period of time. But under Part B, you pay a premium, and that premium is going up to $185 in 2025. So that's a monthly premium. And Part B covers you when, like I said, when you go to see the doctor, lab, x-rays. But Part B also doesn't cover everything. Part B has a gap. Part B has a small deductible, which is about $260, going up a little bit in 2025. And then you generally pay 20% of the cost of whatever the Medicare service is. So, and that is unlimited. There's no cap. So, if it's a lab, it's an X-ray, that's one thing. If it is a course of chemotherapy or major surgery, you can bear a lot of costs if you just have A and B. So the A and B are the starting points, but then everybody has the gaps that are not covered by Medicare Part A and Medicare Part B. And people still don't have any drug coverage. So, and drugs are one of the biggest line items. People can be on drugs that are thousands of dollars a month. So, drug coverage is the next component that you want to have, and that's Part D, a Part D drug plan. And Part D drug plans are changing a lot this year. We'll talk more about that, but that's the drug plan. It doesn't cover the gaps, the cost gaps that you still are responsible for in Parts A and Part B, but at least it covers all those medications that you may be taking on a regular basis or an irregular basis. Now, now we have to get to the question of, well, how do we cover the cost of that $1,600 Part A admission charge to the hospital, or the 20% of the cost you have to pay for your Part B services, which is uncapped. And that's where people will go down one of two paths. The one path, and these paths are very common. They're both very common. The first path to think about is called the Medigap or Medicare Supplement Insurance, and that is a plan that you buy. You pay a monthly premium every month for that plan, and it will cover some amount of the gap up to almost all the gap that Part A and Part B don't cover. And there are different flavors of these plans. They usually have letters like Plan A, Plan F, Plan N, Plan G. Those are all supplement plans, and each one of those covers some degree of the pieces that are A and B don't cover. And so, if you have a supplement plan to go with your Part A and Part B, you will pay a fixed monthly premium for the supplement, and then you will largely have your services covered when you go to the doctor. When you go to the doctor, you show them the red, white, and blue Medicare card. That's what pays first, and then the part that doesn't cover that Medicare doesn't pay, that gap, will be covered in part or completely by the supplement, depending on what type of supplement you buy. The more expensive the supplement, the more it's going to cover. There are some skinnier ones, there's some high deductible versions. There's lots of different ways to get into a supplement plan. But the supplement plans are one way to cover that gap. And so if you have a supplement plan, you will have a Part D plan separately that goes along with it. You'll have your Medicare Parts A, Part B. And if you want coverage for things like dental, you will have to get a separate dental plan. or vision, a separate vision plan. So it's kind of an a la carte type of system. And that's what a lot of folks have. But these days, the majority of folks, it's become the majority, they go down a different path for covering those gaps. They go down the Medicare Advantage path, or what is called Medicare Part C. And you know, it's called C just because that's kind of the section of the law that it comes from. But what Part C does, if you get a Medicare Part C plan, then what happens is, instead of going to the doctor with your red, white, and blue Medicare card from the federal government's paying. The federal government works out an arrangement with a private insurance company who's going to run Medicare for them. So, the number one insurance company that does the most Medicare Advantage plans in this country is United Healthcare. So we'll use them as just an example. They brand things under the AARP brand, but it's United Healthcare slash AARP. And what happens in that case is, for those plans, the federal government, for each member who signs up, they get a monthly payment. The federal government gives United Health a monthly payment and says, look, their care is on you. You have to cover these minimum standards. You have to cover the same things that Medicare covers, but the claim goes to you. You pay the claim, and your job is to do that profitably and to run a plan and create choice for consumers and compete with the other plans out there and try to create a good product that consumers choose. And so consumers can choose to join a Medicare Advantage plan, a privately run plan. It replaces Medicare. When you're in a Part C or Medicare Advantage plan, you still have to pay your Part B premium to the government. If you have to pay a Part A premium, you should still have to pay that. The Part C plan will likely may or may not have a premium. Some do, some don't. Most don't, but that could be. And most of the time, that will actually replace Part A, Part B, and Part D. They will have a combined Part A, Part B, Part D, and a lot of times they will have dental coverage, vision coverage. So it's a one-stop shop, one card, generally a low or no monthly price for that. But what's different about that is you pay as you go, whereas the supplement plans, you pay up front, you pay every month, and you pay very little, if almost nothing when you go. But with a Medicare Advantage plan, you're paying co-payments, co-insurances as you go, up to a maximum, and there's a maximum out-of-pocket limit. So that's another good thing about an Advantage plan, is you have a certain number that you will not go above in terms of out-of-pocket medical expense in the year. However, the biggest downside of the Medicare Advantage plans that many people perceive is that you don't get to see any doctor you want to see. You have to see the people that are in the plan's network. And so Medicare has, millions of providers. It's lots and lots of doctors. It's the biggest network there is. But if you join and you can go see any of them you want, there's no prior authorization. There's nobody saying you can go or not go. If a doctor accepts original Medicare, and most of them do, you can go see that doctor. Medicare Advantage, we are limited to the doctors that you can see. And this question was in the chat. There are two types of Medicare Advantage plans. There is with two types of networks. There is a HMO. If you join an HMO in particular, your costs are going to be quite low on a monthly basis, most likely, but you're going to have a smaller network of doctors you can see. So in a city, maybe there's 3 hospitals, and if you get care, you're going to go to one hospital A, but you can't go to B or C. If you go to B or C, unless it's an emergency, you will not be covered at all. And so in Medicare Advantage, you're reducing the choice in terms of what doctors you can see, in exchange for getting sort of an all-in-one and a lower upfront cost. That's the HMO network. Now, there are PPO-based Medicare Advantage plans, and the PPO plans have in-network like the HMO, but they also let you go out of that network, and you can go see actually any doctor that accepts Medicare can accept that PPO plan. Generally, these have higher out-of-pocket costs. But when you go see an out-of-network doctor, your cost of care is going to be higher. So, you would typically see something like maybe you see a specialist that's $20 if they're in network, and I'm just making this up, and maybe it'll be $50 if it's out of network. So the costs are much, much higher, almost prohibitively higher in many cases. But you can go see them, um, but it's going to be much more expensive if you do. So, if you typically you'll see an HMO. If all your doctors are in that HMO, you're pretty good. Even though they can actually change what doctors are in that network anytime they want. They don't, and so that can be a problem. But a lot of times, it really comes down to the doctors you want to see in the network, and so there's a lot of trade-offs between traditional Medicare and a supplement and a Part D plan versus a Medicare Advantage plan. There's lots of other nuances. If you're a veteran, you have VA benefits, and we won't get into any of that. But generally speaking, those are some of the big differences in the plans. And this is the time of year, it's important to know this because this is the time of year when there are a lot of changes coming through the Medicare Advantage plans. There are a lot of changes coming through the Part D drug plans that you should be aware of. And I mean, the basic place to start is like knowing what kind of plan you're on now. A lot of people I talk to actually are kind of uncertain sometimes. I don't know. I have this United plan. Okay, that could be a supplement plan, or that could be a Medicare Advantage plan. Let's look at and see what the card says, and try to figure that out, because it's important to know where you stand, and it's important to know what changes are coming this year with respect to that.
Thank you for that great overview. I think there's a couple questions in the chat. The specific question from Lori we'll get to after this first section, but did want to address Tony's question since we're still on this topic. He's asking, can they change doctors and network any time of the year?
Yes. So if you're a Medicare Advantage plan, you have your private Medicare plan. Each Medicare Advantage plan will go out and it will do its own contracting with the doctors in the community, and it'll choose to contract with some and not with others. It's a negotiation, and a lot of times what they'll do is, is anything that's negotiated. Maybe they will have a special relationship with just one hospital, and the hospital will give them agree to lower rates because they're going to get more patients, and so the more patients they can send to that hospital, the better rate they're going to get. But then they're going to have to exclude the other doctors, and so there's a lot of that dynamic going on, and there's nothing that restricts the timing of those doctors going in and out of network. I get notices all the time. I got one this morning that was saying, hey, I won't say the health plan, but it's like, hey, just a heads up, we're in negotiations with XYZ hospital system. It doesn't look like we're going to renew our contract with them. And if that happens, then they will now be out of network. And that will happen. That can happen any time of the year. But usually it will happen coinciding with January 1st, but it doesn't have to happen. They can change the doctors that are in the network at any time. By the way, they can also change the drugs that are on your formulary at any time. So there's these private companies, and they're absolutely profit motivated, trying to make decisions around, what to offer. And I talked about this in the other webinar, but if you're a Medicare Advantage plan, you make money by ensuring there is appropriate utilization of care. And appropriate utilization of care is not giving everybody anything they want anytime they want it, whether it's medically necessary or not. And that is sort of the problem with traditional Medicare fee for service, is like there's no limits on what care people can want. And some people are going to, and we know, doctors make money by doing procedures, and people sometimes will, um, some people will take more than they really need, and there's no control on the cost. And so, explicit goal of Medicare Advantage is to get some of the costs under control. And so they put steps in place, more restrictions, with the goal of driving appropriate utilization. But that means that, in order to determine what utilization is appropriate or not, there can be a lot of uh, you know hoops to jump through, and a lot of times there will be debates, because your doctor may want one thing and the Medicare Advantage plan doctors may disagree with them and not cover something. And so that is another downside of a Medicare Advantage plan, is you're going to be subject to what's called their prior authorization rules. And you don't just have your own doctor making your decisions. It's your doctor plus the doctors at the health plan, or the doctors that are contracted by the health plan, to help make those decisions, to make sure that everybody is in agreement when there is, what is appropriate. Is it an appropriate medication? Is it an appropriate procedure? Does this person really need a hip replacement? Is this person really ready to be sent home from the skilled care following their heart surgery? There can be lots of debates about that. Um, and and you know and this is where Medicare Advantage plans will absolutely get a bad rap, because uh, you know they've been known to be much more aggressive in terms of cost containment than many people's doctors think they should. So you there's a lot of trade-offs between these two options.
And maybe slowly transition to conversation around, so what is different about this year's Medicare annual enrollment period from last year? And perhaps I think Stephen was also asking, like, what are some pitfalls to avoid during open season?
Yeah. So this year, every year we have October 15th to December 7th is this window of changes coming to Medicare. This year, and I would say, on a typical year, maybe a quarter of people shop, make a change. Um, Things don't change that much year to year. This year is different. This year has more change than anybody in this industry has ever seen. Um, and so this is the one year where every single person needs to pay attention. They need to shop. They need to understand what they have. They need to understand what's changing, and they should shop. And you should tell all your friends and family to do the same thing, because the changes this year are unprecedented, and they will impact a lot of people. People will be shocked how much it will impact them. And this is if any year, if you're going to take a look at this stuff, this is the year to do that. I'll go through some of the big changes. And a lot of these will probably apply to a lot of folks here. The number one, this we're in the middle of this wave of seeing record premium increases for the Medicare supplement plans. And although you can make that change any time of year, as I mentioned before, the Medicare supplement plans are often tied to the Part D plans, and you kind of want to change them at the same time. So Medicare supplement monthly premiums are, in many markets, increasing 10% or more. We've, we met a lady the other day who her monthly, not annual, her monthly Medicare supplement premium was increasing $130. Um, and you see a lot of this. People, their premiums going up 10, 20, 30%. That's a lot of money, especially when you're on a fixed income. And so, you know, anybody who's on a supplement plan should try to find out what the rate's going to change to in January, if it's changing. Um, compare that alongside the changes to their Part D drug plans, and just know what the differences are, and don't be surprised, and think about if you need to make a change. Number two, the biggest change this year that you really got to watch out for is a huge overhaul of the prescription drug program. And when I say prescription drug program, I mean both standalone prescription drug plans as well as the prescription drug plans that are embedded in the Medicare Advantage plans. So what happened to the prescription drug plans this year? Well, several years ago, we had in this country the Inflation Reduction Act, and the Inflation Reduction Act has done many things to change and to make drugs more affordable, because drugs are very expensive. It has done things like, you've probably heard about the $35 insulin. That was a part of the Inflation Reduction Act. You might have heard about Medicare starting to negotiate drug prices for these very expensive drugs. That was from the Inflation Reduction Act. They took away the 5% cost share that you pay in the catastrophic phase of coverage, which is when your out-of-pocket goes above $8,000. Up until this year, you still had to pay 5%. That went away. But the biggest change of all is happening for 2025, which is that the out-of-pocket max, which is the amount you can pay out of pocket for covered drugs in your plan, that is going from a huge number, $8,000, down to $2,000. So there are going to be a lot of people who will have $6,000 more back in their pocket this year that they are not going to spend on drugs anymore. And that's a big deal. That's a big deal. And the government is paying for a lot of that. The government is giving the health plans more money to pay for this $6,000 gap. But the health plans are also taking on a lot of that extra cost. And so because they're taking on so much more extra cost, and these plans are, getting more valuable, especially for people who have heavy drug usage, expensive or usage of expensive drugs, well, something had to give. And so the plans, have to work within their means. And so the drug plans had to change a lot this year because the drug companies are taking a lot more risk, and they're trying to do everything they can to make sure that there is appropriate usage of drugs, but not inappropriate usage of drugs. And so what we saw this year is, yes, that's $8,000 is going down to $2,000, and there's going to be lots of people spending $6,000 less on their drugs, but it had a huge ripple effect into the plans themselves. We are seeing very large premium increases in the monthly premiums of these drugs. Now, most of those premium increases were capped to be no more than $35 a month, because the government came out with a demonstration program to give the health plans a bit more money, the Part D drug plans a bit more money. And so the Part D plans, most of them participated in that to get a bit more money. That limited their price increases to $35. Well, you're seeing considerable premium increases in the Part D plans. And you should know what you're paying now, and you should know what you're paying next year. But that's not all. We've seen a lot of increases in the Part D drug deductible, which is the amount that you have to pay before the plan benefits even kick in. That went up to $590, and a lot of plans had zero, added that that drug deductible. We're also seeing changes to your cost shares, how much you're paying when you actually can go to a pharmacy before you hit that $2,000 cap. And most importantly, there's a lot of changes this year to the formularies themselves. The formulary is this big document that it has every single drug that exists listed, and it says, is it covered or not covered? And is it covered? If it's covered, what tier is it on? Because generics are on a tier 1 or tier 2, and there's lower cost share. They want to encourage you using that. But if you're on a branded drug, an expensive drug, it's going to be on a higher tier, and oftentimes you have to pay a higher percentage of the cost of the drug. And but the that $2,000 cap only applies to drugs that are on your formulary. So one trick is you could take a really expensive medication off the formulary, and now it's not covered at all, and now you're paying 100% out of pocket. So so it's really, really, really important this year for you to um, take your list of medications that you're taking, plug it in to one of the drug cost calculators, and see what it's going to cost you next year and see what your other options are. The easiest way to do that is Medicare.gov has the gold standard tool. You go to Medicare.gov, you say you want to look for a plan, you put in your zip code. It'll ask you, do you want to add your drugs in? Say yes, put your drugs in, and that's where you can see what this is going to cost you in your zip code for the coming year. And that's a starting point. That's a really important thing to know about what changes are coming to your drugs. We'll talk more about other ways to get help, but that for the drugs, that is really really big changes coming. So know the cost of your drugs going into next year. The other thing they did, which was really interesting this year, is they created an option for you to have a payment plan, and instead of let's say that you for whatever reason might have to pay $1,000 in January and $1,000 in February, um, then you hit that $2,000 limit. Well, now that money that can be put on a 12-month payment plan, and you can pay a couple $100 a month throughout the year. And the health plans run those payment plan services. And interesting, if you sign up for a payment plan, you no longer pay any money when you go to the pharmacy. Your health plan sends you a bill. So just know that if you have the type of pattern of drug spend where you're spending a lot in the first couple months of the year, you're really maybe a really good candidate for um, being on a no interest payment plan that kind of spreads the cost of those drugs throughout the year. Um, so that's biggest changes are coming in the area of medications. That's not all the change, but certainly that is a huge source of change. And then if you get to if you get if you're under a Medicare Advantage plan, there's even more change. So Medicare Advantage plans oftentimes will have a drug plan built in. So everything I just said about the drug plans applies to the drug plan that's in the Medicare Advantage plan. But Medicare Advantage plans also had a lot of other cost pressures this year. And so they themselves have made a lot of changes to their deductibles, their out-of-pocket maxes, their cost shares, the amount of the supplemental benefits in the plans. Like, you see a lot of plans reducing the amount of dental or over-the-counter benefit in the plans. You're also seeing some things that aren't as obvious, which are changes to the doctors that are in the network. So a lot of the networks have changed in the Medicare Advantage plans. But probably the biggest thing that is different about Medicare Advantage plans this year is a lot of Medicare Advantage plans outright have terminated. They've closed up shop. They've sent people notices saying this plan is being terminated. You have to go find another plan. About 2 million Americans got letters that their Medicare Advantage plan was actually 100% being terminated. And if they don't take action, they don't read that letter. They don't take action. January 1st, guess what they're going to have? They're going to have Medicare Part A. They're going to have Medicare Part B. They're not going to have a supplement. They're not going to have anything to cover the gap. And so there are probably a lot of people who are going to be surprised by termination when they go to the doctor January 1st because they didn't read the termination letter they got from the health plan. They'll still have 60 days to sign up for a new plan, because when a plan terminates, you're actually not even subject to you have a different enrollment period. You're not subject to the December 7th deadline. If your plan has terminated, you have until December 31st to sign up for January 1st. If you miss that deadline, you go into January 1st. Anytime in January, you can sign up for a February 1st effective date. Anytime in February, you can sign up for a March 1st effective date. So you will have a bit more time if your plan has terminated. And this year, a record number of plans have terminated. So it is, you have to make sure your plan even exists in the coming year. So it's just it's just sort of a massive amount of change coming. And this is why, it's important for you to know what change is coming for you. And, tell everyone that's on Medicare in any shape or form to make sure they're checking, because there's not going to be a lot of awareness. Thankfully, now we're past the election. The election, uh, you know, flooded us with lots of other types of advertisements and so forth. And so a lot of people, especially in swing states, uh, haven't even seen, the amount of Medicare promotion that other people have. So, a lot of people haven't even started thinking about this, and they're starting to think about this now. But in terms of waiting, we also have one other interesting dynamic for this year. Uh, a lot of people, and we see this trend in the industry every year. There's a huge percentage of the population, they procrastinate and they wait till after Thanksgiving to sign up for Medicare Advantage plan. Um, and so there's always a rush at the end. And in a big year like this, there's going to be a big rush in the end. Well, guess what? The calendar is not working for us this year. We have a really late Thanksgiving this year. Last year's Thanksgiving was about a week earlier than this year's Thanksgiving. So if you're waiting till after Thanksgiving, this particular year, the Thanksgiving is really late. That means the number of days after Thanksgiving before December 7th, the end of December 7th, is super small. Uh, do not wait until after Thanksgiving. Get this done now, because there's every broker in the country who can help you. Every customer service line at every at Medicare.gov and every website is going to be totally swamped after Thanksgiving. Um, doesn't mean you shouldn't try if you do wait, but and it is to your advantage to try to figure this out before Thanksgiving if you can. Um, all things are going to be a little calmer. You're going to have uh, less, more attention, and less having to wait. Um, so lots and lots of changes. This is the year to pay attention, to understand how the changes impact you, um, and really, you know, be thoughtful about it.
Thank you,
Uh,
Scott.
I just want to just scan through there's some sort of good inline questions here. Um, um, are supplementals terminating as well? Um, we haven't heard a lot about supplements terminating. It's more just price increases with terminate supplements. Sometimes you'll see a supplement, um, and they will stop selling to new people, but they will still continue to serve old people. You would, because they're the way they're regulated, they're not going to just disappear necessarily. Um, but it's more about the price increases with the supplement plans this year. Um, and
One
let's
question that I got directly was that Frank is using traditional Medicare with a Medigap plan, and he's heard that once you choose Advantage, it's almost impossible to go back to traditional Medicare, but also heard that there's a window that one can use to change back without requiring additional screening. Is this true? What is true?
so what is true federally is that if you've never been on a Medicare Advantage plan, you're on a supplement plan, you want to try Medicare Advantage, you have a 1 year period to go back to the supplement that you're on, if you are not satisfied with the Medicare Advantage plan. Past that 1 year mark, and you're able to go back to the supplement plan you were on without going through medical underwriting, have to answer medical questions. You can get on any supplement plan anytime you want if you're willing to go through, and you can pass their underwriting questions, but they can deny you. But you have a guaranteed issue right. That's what it's called. You're guaranteed to be issued a supplement plan, to go back to a supplement plan for a 1 year period, after you've tried Medicare Advantage for the first time. Um, and you can do that if you are turning 65 and you want to try Medicare Advantage, or you've been on a supplement for years and you want to try Medicare Advantage. You can try it for a year, but you better be darn sure to like set the reminder on your calendar to 11 months in or whatever, to evaluate whether you want to go back. Because once you hit that 1 year point, then you would be subject to medical underwriting. The exception to that being that individual states will have their own individual rules about when you can get into Medicare or supplement plans with guaranteed issue. There are states like New York that are open states, and you can go back to Medicare supplement anytime you want. There are states like Maine where that 1 year period I mentioned is actually 2 years. There are states like California where if you have a plan that terminates, you can go back to a supplement. If your doctor leaves the network or your co-pays for visiting a doctor increased by more than 15% in California, that triggers your ability to go back to a Medicare supplement with guaranteed issue. But um, most of the time, it's a 1 year period. But if you're, it's probably good to know what the rules are in your state in particular when it comes to that.
We talked a lot about changes. What's the best way to shop around for something that is better, cheaper, more inclusive for yourself?
I think that um, there are there are so many changes, and these plans are so inherently complicated. I, you know, I am a big fan of getting help from a professional that does this. Now, you can get a lot of information at Medicare.gov when it comes to all the plan options that are available. One thing, Medicare.gov, its search engine does not search for your doctors. So that's a big problem. You have to go to each individual carrier insurance company website, retype in your doctors every single time. That's a very painful, long, drawn out process. So Medicare.gov has great plan information, great drug coverage information, but they don't have provider coverage information. Um, there are in every state, there are nonprofits. If you go to a website called shiphelp.org, there are nonprofits that help people navigate Medicare. Um, they cannot recommend specific plans or enroll you in those plans, but they can at least, answer basic questions, get you started. Um, Call 1-800-Medicare. They will help you quite a bit if and that's a good resource. But I think that you know the best way to navigate this is to get help from an expert. You can work with a licensed uh, agent that works with lots of different insurance companies. They can help you shop. They can help walk you through it. They can help you understand your needs. Um, and this is what they do every day. So they have a lot of experience with it. They understand what the terminology means. And getting help from a professional, it will cost you nothing. Is a very good solution for a lot of people as well. Um,
About working with licensed agents, can you talk a little bit more around how do they get paid? Anything else you should know when you're working with them?
yeah. So licensed agents, they contract with the health insurance companies, and they're paid by the health insurance companies to help people enroll in plans and then to service those members throughout the year. So they're paid on an ongoing basis to be there to answer your questions, to help you navigate problems, to make sure you understand how to use your benefits. It's like having somebody on your side. Um, Medicare has rules that set how much agents get paid. That is the same amount at every health plan. So, they're trying to, remove, provide this sort of external customer service. Um, because frankly, the health plans can't handle all the volume in this short period of time. So they outsource that, but it's already paid for by the health plans. Um, so that's the good news. The the bad news is there is certainly bias in working with anybody. And one of the things to be aware of is, um, a, you know, there are dozens and dozens and dozens of health insurance companies in this country, and uh, a licensed agent has to sign a contract with each individual one that they're going to be able to help you with. And so, um, you know, a lot of times what you'll see is licensed agents, and I'm no different. You'll get contracts with the big guys, Humana, United, Aetna, Cigna, Anthem, um, you know, 6 or 7, 8 major national plans, and you'll be able to shop amongst all of those. But you may not, and like I live in California. There are many small local health plans in California that uh, I I don't contract with. When you contract with a health plan, you have to go through a whole contracting process, a whole certification process. Every year you have to take additional tests, and it becomes, so you have to, you have to know that, you know, there's virtually no insurance folks out there who work with every single possible health plan, and and one of the new rules is they will disclose to you how many organizations they work with and how many plans, and that's a part of the required disclosure. But typically, you know, a good independent agent will work with, all the major national plans, the local plans in your market, and can help you. And that's what we do, at our agency. We have lots of contracts. We try to work with as many as we can to give people, the hand holding they need through the process. But uh, there are a lot of agents who don't contract with every health plan, and that brings me to, like, you see these commercials on TV, these very slick ads, and they want you to call. And they are when you call one of those numbers, um, you're not talking to somebody at that company. Those numbers on TV are companies that all they do is put advertisements on TV. When you call that phone number, they're selling your call to whatever licensed agent raised their hand and said, "I want to pay $50 to talk to a human being." Um, when that call comes through, you make that call to that phone number on TV. It's got the need ad. Uh, Medicare agents in your area are going to bid for that. And in real time, somebody, they connect to somebody, and that person they connect you to, maybe they only write for two of the insurance companies or three of the insurance companies. And so they're going to be trying to likely influence you to work with, you know, uh, whoever they can sell, just the plans they can sell. And so that, you have to, it's important to have a sense for which insurance companies a licensed agent work with. Um, Insurance companies won't let licensed agents in some cases sell all their products. And so but it's fair to ask, are there any products? What products can you not sell me? And what products are there? Any products that the you're not allowed to talk about, because that does happen. So it's not perfect, but you know I mean, generally speaking, you could save tens of hours of time working with an expert. Um, it doesn't cost you anything. Um, and you find somebody you like to work with, they're knowledgeable, they're helpful. It can just, you know, be such a good experience. At our company, I watch, we have a real time report of, like, the satisfaction surveys coming from uh, the people we work with, and we have a satisfaction rate over 90%, and it's great to hear the stories. So you know there's no perfect solution. Unfortunately, these plans are all complicated. They're all different, and there's no perfect solution for consumers, uh, other than, you can go get your insurance license and become an expert and do nothing but this. Some people do that, but that could be fun. Um, but it's good to get somebody who knows the market and can share the insights that they've learned from doing this all the time.
Definitely. I want to get to some questions from our members. I have three in the pipeline. I see Gail's hand is raised as well. Let me first go to question from Lori from earlier on, and then we'll go to Gail and address the last two. So Lori was asking, she lives in an area with only two Advantage PPO choices, but her current plan, UHC Advantage, is pulling out for 2025.
Yep.
Her doctor's facilities are in both plans. One plan is $10 more monthly, but out of pocket cost would be cheaper. She went with the plan that costs less monthly, but the out of pocket costs are higher. It seems to have a better reputation, and is the one that her insurance agent recommends. She was asking, like, does that sound like a sound strategy in these situations? How should one think about it?
Yeah, I mean, I think I you're I would generally think if you're working with a local agent knowledgeable in the market that they're going to steer you in the right direction. Um, a lot of times, you're playing a bit of it's not going to be perfect because you're not going to know exactly what's going to happen to you. The one thing I will mention is that if you are under a lot of times you're under 70, and sometimes it can go up a little bit higher. You can get guaranteed issue into what's called a hospital indemnity plan. And hospital indemnity plan lets you pay a small monthly fee to cover the gaps in a Medicare Advantage plan that it doesn't pay. So it's kind of like a supplement plan for the Advantage plan. And that's another thing to consider if you really, you're in an Advantage plan, you're concerned about the costs. You know, might you might still have unexpected costs, say for a hospitalization or an ambulance ride. There's some really good hospital indemnity products that most people don't know about, um, that should be on your radar. Um, but you know, if you're working with a local folk, somebody who's local and knowledgeable in the market, they're working with all the plans. They're going to, and they should walk you through every detail of the plan and help you kind of think those things through. But yeah, we in our markets we see a lot of those United PPOs leaving the market, and um, it's causing a lot of disruption. By the way, somebody's asking, if they want to work with me or my team directly, we've got a phone number here that we'll leave you at the end. We'll leave you contact information. Um, we can definitely help with that. There are a lot of comments spread through this about sort of our political situation, and there's a lot of things that are unknown. I think certainly with especially who's going to be in charge of Health and Human Services and CMS. I think that uh, Republican administrations are heavily uh, they are very supportive of Medicare Advantage, whereas the Democratic administrations are more in favor of original Medicare and supporting that. So I think we're going to see, a lot of people are um, inferring that we're going to see a strengthening of Medicare Advantage, more people going to Medicare Advantage in the coming years. For some of the reasons we've talked about, I hope that this also is combined with some reform the Medicare Advantage, because obviously there's a lot of downsides to it. We'll have to kind of wait and see. But I think that there is expectation that uh, you know both Medicare Advantage and what's called value-based care will be supported under this coming administration. But yeah, it's hard to know until you know we'll get some early indication of that early in 2025 as to what's going to happen in 2026.
You already answered one of the questions, who was asking about the new administration. Um, Elise, I think you have a question and wondering, you're asking
Well,
whether the agent you work with needs to be local or
yeah,
not.
does it need to be in your state?
So they have to be licensed in your state to work with you.
Okay.
Uh, but like I'm licensed in all 50 states.
Oh,
Uh,
great. Okay. You answered
so and I have several folks on my team. We have coverage in every single state in our company. We have there's some states where we have lots of people in the state, and sometimes people are working remotely. Um,
including New York.
yeah, uh, we cover New York, um, and we have several people who are licensed in New York. I guess age is relative in this situation, but yeah, typically if you sign up for a hospital indemnity plan, a lot of these plans, it depends on the plan. Some plans you get to keep as long as you live. Others, the rates can increase. So it really depends on the plan. You just have to look at the particulars of the plan. But it's definitely something I'm recommending people take a look at this year if you're on a Medicare Advantage plan. There was a question I know we had about from somebody that was on the chat. It was submitted in advance about if you're turning 65 and you're with an employer. So I want to just cover that briefly for those who want to hang on. So when you turn 65, if you're employed, you can stay on your employer plan. If you are, and a lot of people, when they have employer-based insurance because they're an employee, not a retiree, but if you're still working, you're 65, 66, 67, 70, whatever, you're still working, you're still eligible for your employer's benefit and Medicare at the same time. If you are working for an employer who has more than 20 employees, that employer, their coverage pays first. If you're on Medicare, Medicare is going to pay second, kind of as a supplemental. A lot of times people will, at age 65, start Medicare Part A because it costs them nothing. But if you're covered under an employer plan, you don't necessarily have to sign up for Part B and pay those monthly premiums because that's a secondary coverage to what your employer already has. So a lot of times, people will wait until they are no longer employed, and then they join Medicare for the first time. And if you do that, it's effectively just like joining Medicare when you turn 65. The one wrinkle that is coming this year is that a lot of employer plans used to, or I should say, the drug coverage in most employer plans used to be as good as Medicare's. And so Medicare was like, that's great. You have equivalent coverage under your employer for your Part D, so you don't need to have Medicare Part D coverage. That is changing this year. So if you're covered under your employer's plan, you're still working, there's a chance that your employer's coverage on Part D is no longer as good as Medicare's. If it is not as good as Medicare's, it is not considered to be, the word is creditable. Then you are exposing yourself to a late enrollment penalty by not getting Part D coverage. And so your employer will have sent out a notice about a couple of weeks ago about whether your employer Part D plan is considered to be creditable under Medicare for 2025. If it's not, then you need to think about signing up for a Part D plan, or maybe just moving off your employer's insurance altogether and onto Medicare. Or you could be subject to a Part D late enrollment penalty, which is a penalty you'll pay every month for the rest of your life. So that's just another gotcha with the changes for this year. But a lot of people will, generally speaking, delay enrolling in Part B while they're still working and they're covered under their employer's plans. For employers under 20, or under 20 employees, you do have to sign up for Medicare when you turn 65 because Medicare is the primary payer for those employers.
What are the most important things our audience should be doing between now and the end of the Medicare annual enrollment period on December 7th?
Yeah, know what plan you have, know what is changing about that plan, premiums, which is your monthly payment under the plan, what it costs you to go see the doctor, what it costs for you to pay for each of the medications you're on, and to make sure that the doctors that you want to see are still covered. Know what those changes are ahead of time, so you don't have any surprises. And then make a change before December 7th, so you'll be in good shape for January. And I do encourage people to get
If you
help.
do nothing, it stays the same.
If you do nothing, it stays the same unless you're subject to a termination. If you're subject to a termination, you'll be involuntary. If you have a Medicare Advantage plan that's terminating, you'll be involuntarily moved back to original Medicare. So that would not be good, because then you would have you're on the hook for the parts that are not covered, especially you have an accident or something major happens. There are a lot of drug plans that are also terminating. You could be in the same situation. So if first of all, make sure that the plan you're on is actually going to be around. And we know somebody on this call who just mentioned that their plan is terminating. So it's happening a lot. It's happening, more frequently than it's ever happened before this time of year. So in that case, I worry about people who, they never had a drug deductible before. They don't know what a drug deductible is. And now they have a $590 drug deductible that got added to the plan. Could be a Medicare Advantage plan or a Part D plan. They go to fill their drugs at the pharmacy in January and they're like, here's my $10. And they're like, no, that's going to be $365. And then they have a panic attack because they had no idea. They never paid attention to anything. And there are a lot of big changes like that coming. It's just be aware of what it's going to cost you to fill your medications in the new year, whether your doctors are going to be in network, whether your plan is even, functioning or has been terminated. So just, it's worth taking an hour or two to kind of go through it or go through it with somebody to see where you're going to be in the new year. The Medicare Advantage and prescription drug plan, they've sent all their members a letter called the Annual Notice of Changes. We did a whole webinar with Hively on that, how to read that letter and look through it to see what your changes are. So that might be a good one to refer to. So, they are required to disclose these changes. They do it, but a lot of times it's a letter you don't read or an email you never checked, and you miss it.
Welcome, everyone.